Okay, we are live. Good morning, everyone. Today's session is going to be really helpful and is led by Dr. Ruchi Tandon from Apollo Cradle and Children's Hospital. She's going to talk about importance of HPV immunization in young adolescent women population. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Yes, thank you for your kind words and thank you for the introduction. Hi, I'm Dr. Ruchi Tandon. I'm a practicing gynecologist and obstetrician at Apollo Cradle Royal Nehru Enclave. And welcome to this platform, especially all the young girls, the ones above the age of 9. This session is specially for you. I think you've heard in the news a lot of controversy around whether the cancer vaccine or the HPV vaccination is safe, at what age it should be given. Well, the idea is to enlighten you all about what is HPV, the virus, and how we can go about with the immunization of it. Now, what is HPV vaccine? HPV vaccine or papilloma virus is also called as HPV. It is spread by sexual activity. Some strains of HPV can cause genital warts. Other HPV strains can cause cancer. Most of the time, the body can find and clear out the HPV. But if the virus stays in the body for a long time, it can cause cancer. Getting vaccinated against HPV helps in preventing cancer in both men and women. Now, what does the HPV vaccine do? The HPV vaccine protects against genital warts and most cases of cervical cancer. It protects against cancer of the vagina, the vulva, the penis, or the anus, which is caused by the HPV. The HPV vaccine also protects against mouth, throat, head, and neck cancers caused by the HPV. The vaccine given gives the body a safe way to build an immune system and spread an awareness of some of the HPV strains. This means that the body has an easier time clearing out those strains of the virus if the person catches the later. Now, who is the HPV vaccine for and when it should be given? The Gardasil 9 vaccine is approved by the US FDA. It can be given to people beginning from the age of 9 and older. This vaccine can be given at the same time as other vaccinations. The CDC, or the Center for the Disease Control, suggests that routine HPV vaccination should be done at the age of 11 or 12. That is the ideal age for vaccination before a person is actually sexually active. Now, once a person gets HPV, the vaccine may not be as effective. That is because the vaccine is goal is to be present. It is to inhibit a new infection. If a person has the virus, the vaccine may not help the body clear out the vaccine. Research has shown that receiving the vaccine at age 9 or younger age isn't linked to an earlier start of sexual activity. People younger than the age of 15 can be vaccinated with 2 doses of HPV vaccination, that is 6 to 12 months apart. People who start the vaccine services later, that is at ages of 15 to 26, should get 3 doses of the vaccine. These shots are given over 6 months of period. The CDC suggests to catch up the HPV vaccination for all the people through the age of 26 who aren't fully vaccinated. The FDA approved use of Gardasil 9 for males and females is between the age of 9 to 45. If you are of the ages of 27 to 45, please discuss with your healthcare provider. Together, you can decide if you should get the HPV vaccine. Now, who should not get the HPV vaccination? The HPV vaccine is not given during pregnancy. The HPV vaccine is not recommended if a person has severe life-threatening allergies. Also, people who are moderately or severely ill should wait until they feel better to get vaccinated for HPV. Now, does the HPV vaccine offer benefits if you're already sexually active? Well, people who are sexually active should talk with their healthcare team about the benefits of getting an HPV vaccine. Most people catch HPV soon after they become sexually active. But if you have one strain of HPV, you might still benefit from the vaccine. It can protect you from other strains that you do not have yet. But none of the vaccines can treat an existing infection of HPV. These vaccines protect you only from specific strains of HPV you do not have. Now, does the HPV vaccine carry any health risks or side effects? The HPV vaccine has been found to be safe in many studies. Overall, the effects tend to be mild. The most common side effect of HPV vaccine and includes soreness, swelling, or redness at the injection site. Sometimes dizziness or fainting occurs after the shot. Staying seated for 15 minutes after receiving your shot can lower the risk of fainting. Headaches, nausea, vomiting, fatigue, or weakness may also occur. The CDC and FDA continue to monitor the vaccines for unusual or severe problems. Nothing has been documented so far. Do women who have received the HPV vaccine still need to have a pap smear test? Yes. The HPV vaccine doesn't replace a pap smear test. Screening for cervical cancer with regular pap tests starting at the age of 21 is an essential part of preventive healthcare. Get medical attention right away if you notice any symptoms of cervical cancer. Some symptoms of cervical cancer are vaginal bleeding after intercourse, or bleeding between periods, or postmenopausal bleeding, pelvic pain, or pain during sex. What is the Indian scenario of HPV infection? Cervical cancer is ranked as the most frequent cancer in women in India. India has a population of approximately 36 million women above the age of 15 years who are at the risk of developing cervical cancer. The current estimates indicate that approximately 132,000 new cases are diagnosed yearly and 74,000 deaths annually in India. That is accounting for nearly one third of the global cervical cancer deaths. Indian women face a 2.5% cumulative lifetime risk and 1.4% cumulative death risk from cervical cancer. At any given time, about 6.6% of women in the general population are estimated to harbor cervical HPV infection. HPV serotypes 16 and 18 account for nearly 76% of cervical cancer in India. Now, there are three types of HPV vaccine which are available. In India, we have a quadrivalent vaccine, which is popular by the name of Gardasil 4. We have Gardasil 9, which is effective against 9 strains of HPV. And we have the Indian variant, which is Servarac, which is yet to be introduced. And there are, talks about improving it into our national immunization program as well. If you feel that you are at risk of developing HPV infection, you can take this between the ages of 9 to 44 years. Please talk to your healthcare provider. We are an open platform, and it would be best to discuss with your treating gynecologist about your immunization dosing and scheduling. Thank you so much for this session.